need one you. Don't need one you. No need one you. Don't need one you. No need one you. Don't need one you.
This is Labram Musah, a passionate advocate for public health and sustainable development in Ghana. He is the Executive Director of Vision for Accelerated Sustainable Development, also known as VAST Ghana, a civil society organization working to reduce non-communicable diseases, promote road safety, and fight climate change. Mr. Musah's tireless efforts in tobacco control and health promotion have earned him international recognition. In 2025, he was honored with the prestigious WHO World No Tobacco Day Award. Labram Musah continues to inspire action, shaping policies, saving lives, and building a healthier future for Ghana and beyond. From policy advocacy to grassroots action, Labram Musah has been at the forefront of Ghana's fight against tobacco. Welcome to the tobacco control story of Africa. And now, let's hear his journey in his own words.
Hello everyone, my name is Albina Majiwa. Welcome to the Tobacco Control Story of Africa featuring Ghana. So welcome Mr. Labram.
Thank you for having me.
The busiest man in Africa. Oh my goodness.
I don't know why you would attribute that to me. That's okay.
Yeah, but you're very busy, so thank you for sparing your time to come and talk to us about the Tobacco Control Story of Ghana. So what motivated you to start tobacco control?
Well, I mean, it's a long story. It's all the way back when I completed my secondary school. You know, I had a passion for community work. But even beyond that, my parents, my father specifically, happened to be a smoker. So well, I wouldn't say that was the motivating factor for me to venture into tobacco control, because eventually he stopped. But the effects that the smoke had on him was very devastating to the extent that he developed some chronic diseases, and that's also translated into my mother. Then this also got the smoking doesn't only affect a smoker, but also affects people who are living in a household. And then my brother was also, having to, in fact, it's dead to me that indeed, even his asthma could have been, to the smoking could have been a contributing factor to his asthma, because then he was having a lot of difficulty, growing up, as a young guy. So eventually, after SS, then I went to the university. After university, that was when my dad passed. Then I thought that there was a need for me to begin, working around this space. So, boys, so as a long story, but there are instances where something actually pushes you to become an advocate. So eventually, that story catched me. Father being a smoker who was a chain smoker, eventually he stopped because, there were issues around, health issues. Eventually he passed on. So, that motivated me to pick up a habit. Okay, then why don't I, begin to speak more about tobacco and the effect that it has on people, because I happen to be somebody that lived experience of it.
Your brother?
Yes, so my brother is alive, and was the asthma is not so much of an effect on him than it was doing to him when he was growing up. Yeah.
So please tell us about how when Ghana signed the BHLCTC, how was the political climate that time? And how was that? It was in 2004, yeah?
Yes, so it all started again. So then we were working around HIV and AIDS, to 1999, when the issue of HIV and AIDS became an issue in Africa and in Ghana. So we were, actually advocating for it. But alongside we have to change, our priorities and look at more into tobacco, because in the conversation around tobacco, the Federal Convention of Tobacco Control has started. The INB has started. They end up coming out with a framework, which was adopted by the WHO. And then we have to begin advocacy, for Ghana to sign on to, and I remember we were very young guy growing up. We advocated for Ghana to sign, to ensure that at least among the 40 countries, Ghana, played a major role. So Ghana signed on, and I think we're the ninth country to have signed onto the FCTC. And then we also ratified it immediately. I think in 2024, we ratified it. So Ghana joined the rest of the world. In fact, Ghana was among the first country in sub-Saharan Africa
To sign.
to sign. So, and then the convention, you get 40 countries, for it to come into law. Indeed, somehow we're happy that Ghana was part. Indeed, happy also to extend that we were, involved in the process by that time. To push, the government of Ghana by engagements, for Ghana to be part of the first 40 country.
Was there a lot of tobacco industry interference when you're pushing for this?
No, so then there wasn't much. Because the real advocacy hasn't started yet. Though we're engaging members of parliament, but it has to do with the legislature. Members of parliament must sign onto the documents. So of course, it has to go to the Attorney General Department to vet to ensure they defeat the purpose. They have to go to Parliament. In Parliament, we have to also do our advocacy, encourage them, because many countries are signing on to. And Ghana was also seen as a champion even before the Framework Convention. Ghana was already putting in measures, to protect citizens from the harm of tobacco. And even before we signed onto the FCTC. Then tobacco, growing, and then also the factory in Ghana had already left Ghana to Nigeria. Way back in 1999, they left Ghana even before we signed onto the. So there was that kind of commitment. So at the time, Ghana also contributed, actively during the negotiation, the INB, that led to the birthing of the WHO FCTC. So yeah, it honestly, it was easy, but it wasn't, very, very difficult to get the Ghana to sign and also to ratify it by Parliament.
Tell us about the instance of the exact signing on that day. I know there is a story behind it. If you don't.
So like I said, there was so much drama. Of that. The difficult and drama actually started when we have to, tirelessly work and advocate, for it to be domesticated into a law. And that's where the whole drama started. So, and that took us, I think, about 8 years. Because Ghana signed on by 2024, Ghana already have signed and ratified. So from that time, when the FCTC became, a law, we then have to start the advocacy. So from 2005, 5, up to 2012, before we got a law on tobacco. So you can imagine, so from 2005,
that's long,
all the way, so this tells you that, within that period, that was where we had a lot of setback, a lot of, industry interference, we had a lot of lack of commitment from government to push, the FCTC. Government come, government go,
You have to readjust, reintroduce yourself, start the process. But, what keeps you motivated?
Was so the passion for the work, the devastating effect that we think that is having people. There wasn't much commitment from many people. People didn't see, tobacco as an issue. They thought about is smoking, and they didn't see the raw impact, the raw effects. Because data was very limited. If you don't have data, you can't speak of anything.
It's hard to.
Policymaker will tell you that if you are speaking about the harm of tobacco, where is the data? And we are quick. At bringing on board WHO data, other countries' data, and they're like, no, we want locally created evidence.
Data, yeah.
Because we are not Kenyans, we are not Nigerians, we are
Yeah.
Ghanaians. So
You want
give us the data
data.
from Ghana that shows that this number of people are dying from tobacco-related diseases or something.
Yeah.
You
Let's
know.
talk a bit about taxation.
Yeah.
Ghana has shown a lot of progress. We are always told to, learn from the case study of Ghana. So, how did you achieve high taxes, like to the WHO recommendations?
So the issue of taxes on tobacco specifically has been on the agenda of the Ministry of Finance, for a long time. I remember in 2017 or 2027. So we are not there yet. 2007, yes. So Ghana, was implementing a specific tax on tobacco.
Yes.
Which is the best, as far as, the structure or the most effective tax measures concerned. But for whatever reason, which we're yet to know, governments change from specific back to ad valorem, because we're doing ad valorem, and then governments had to shift to, specific. And then I think after 1 to 2 years, we turn back to ad valorem. Only those who were there at the time will know the exact reason why Ghana shifted. But of course, for some of us sitting behind and seeing what the industry can do, and the fact that they love to see countries implementing ad valorem instead of either a mixture or a specific, because the challenge that we have with ad valorem.
So what would you advise governments, especially the Kenyan one, when it comes to taxes?
Right. So in terms of taxes, of course, you need to generate evidence. So like I mentioned, in 2010, we continue to progressively increase taxes.
Yeah.
But it has been ad valorem from 2010, 11, 12, up to around 2023 before we managed to change the tax structure to a mixture. So it was quite a challenging moment, for us. So the point is that we need to create local evidence to substantiate or to justify why, a specific tax or a mixture of the two is most impactful in terms of public health, and also in terms of reduction of the usage of this product by young people.
Of course, we have to talk about Article 5.3 and the importance of it and how governments must prioritize it. In Ghana, how have they managed to prioritize it?
Well, so I would say that has helped us to advance, the policy that we are currently advancing. Because, like I said from the beginning, civil society play a very crucial role. Sometimes we understand the issues even much more better than something the government, representatives. So the onus lies on us to continue to engage government, to understand why there's a need for them to limit interactions with the industry. It's very difficult because what the industry will come with.
Yeah.
The favors. We know it's been documented, right? But the point is that when we continue to expose, sometimes you have to do that, civil society.
Yeah.
Expose the wrong. Let them understand that you are watching and you know that this is what they are doing. And that's why I'm happy about this. The industry index is helping us to document industrial activities that is, impacting on government's, ability to advance public health policies, especially for tobacco control. So there's that need for that agency for us to continue to drum home the adequacy, and then possibly if we can, frame it within policies, because governments all over the world, and I think even in Ghana and other countries, have mechanism for public officials. Unfortunately, it doesn't cover their interaction with industry. It's like free for all. Every time government want to have a partnership with the private sector, but it's not a private sector that has good intention. Some they only think about their interests.
And also they should remember that it cuts across all agencies, not only Ministry of
definitely.
Health, Ministry of Finance. Yeah, Article 5.3 is across. You talked about the deceptive marketing tactics. Tell me more about that in Ghana, what you've observed.
Right, so...
Especially targeting youth.
Yes, so, this new emerging tobacco, but that's why in the premise of, the Tobacco Control Act in Ghana, there's a specific clause, that kind of ban, non-tobacco products. So it can only be used for recreation, for cessation purposes, but not for recreational purposes. So here, if you advance the argument, that means that the only time, Ghana or the youth of Ghana, or the industry can, make their product available in the market is only when it has gone through, because if it's for clinical, for cessation, it must go through the process. It must go through the process of verification, clinical trials, for us to authenticate that indeed this medicine or this harm reduction, so-called harm reduction they're talking about, is fit for purpose, and indeed when people are smoking and they use it, it will reduce, but currently that isn't the case. There's so much violation even with that, and we are having aggressive, marketing. But see, like I said, all of this boils down to, the monitoring mechanism that civil society put in place. We serve as a very credible watchdog. Also working with the media to expose and to show that anytime we see, wrong, we report to the appropriate agencies. Sometimes they are reluctant, but when we quote relevant sessions, whether from the WHO for whatever, then they are quick to react. So there has been that kind of, collaboration between, the government of Ghana, specifically the Food and Drugs Authority, that's the regulator, to ensure that there's no advertisement of any kind. And
have you seen adverts in Ghana?
Yes. So if let me see, there are punitive measures that are in place that when you do, you be penalized. So you hardly see tobacco advertisement. You hardly see whether TV or radio. What they do is that they work to celebrities, directly or indirectly. So that's where they...
So celebrity endorsement.
So they expose, young people by smoking, in how do you call it, when necessarily having an anti-tobacco messaging to show that it's harmful to health, as we see in other, movies.
And that's very similar to what's happening in Kenya. Advertisements through personalities and also in the news, in the media. Ahead of COP11, how can countries collaborate together, especially the African region?
Well, so for me, I think that it has always been a challenge, and frankly speaking, it has always been a challenge for the African region, especially in the lead up to, to COP. And we are hoping that things will get better, along the line, especially when it comes to, organizing our front and then ensuring that we have the expertise, because COP is moving beyond the health sector. So there's a need for us to look at the agenda items and then identify who are the technical people at the country level that can represent us better.
Thank you.
Because sometimes you go to the COP and then you find that, others come more prepared. I'm not saying that we don't prepare, but I said well prepared, and they know what they are coming to advance. Sometimes you also have African countries that go, they're well prepared, but well prepared in the sense that they call the, for want of a better word, sometimes you have infiltration of the industry, and because industry know what they want, they can't well prepared just to water down, some of the argument that is being put forward that would inure in the benefit of everyone. So the point for me is, and this is something I've been advocating in my country, that we should change narrative. If you are going to COP, and COP is about cessation,
yes,
who are the technical experts who understand cessation, and that can actually help us to understand and make cogent argument on the floor. If it's about mob is technical. In fact, it's beyond the Ministry of Health. How do you get people? Of course, you can do without
trade, you can't do without agriculture, you can't do without transportation. At the point, that's where we need to start, the integration. You don't discuss, health matters in isolation. You need to bring the key stakeholders, because now health is political. Health has transcend, across all sector ministries. So we need to identify champions in almost all these critical sector ministries, especially for trade and also for agriculture, for you to understand why it's important to, to elevate the discussion, beyond, commercial interests of the industry. Exactly. We're also looking at it from lens of, of public health. So we're able to advance our, so the point, really for me is, let's go beyond just, bringing the, the health sector. It's very important, but look at the agenda item. If we need the technical expertise from GRA, because we are doing track and tracing. You can't do track and tracing by bringing Ministry of Health. Yeah.
The Revenue Authority must be on the table.
It doesn't work like that. But but over the time you go to COP and then you wouldn't find a whole delegation will come and you wouldn't find a technical expertise. But we have them at our country level.
We do have. Yeah.
So let's begin to so that is when we go as African, we're able to also to advance argument that would support our own local people to be able to advance argument that will protect the citizenry.
Closing remarks. I know we can talk on and on and on. First of all, congratulations on the World No Tobacco Day Award. I know it was not easy. This thing is not easy. You've said you've fought for the first of all ratification and then implementation. Now you also have smoke-free policies. The smoke-free initiative that's going on in Ghana. It's never easy. But what would be your advice to youth? I really want you to speak to the youth who will really carry forward the baton, and then governments. Yeah. So yeah.
Right. So with government and also for civil society organization, what I would say is that, you see, like I said, health have become a big thing, everywhere. Let's not look at even health in isolation. Let's look at the connection, because tobacco control has everything to do with non-communicable diseases. It has everything to do with UAC, universal health coverage. It has everything to do with health policy in general in our country. So let's identify every policy that is being developed in the country, because every policy will definitely look for resources. And the WHO, FCTC have clearly shown us the way. The financing for development, the second one was held, this year, clearly has mentioned tobacco, the FCTC as the mechanism to raise funds to support health, but more especially tobacco control. So let's do the integration. Let's connect the dots so that we are able to lift the bar. When government understand the connection, how tobacco affects every facet of our development, then they will commit to supporting it. And then also to our youth, the youth are more obsessed with this new and emerging tobacco product. My observation, I'm happy that a research was recently conducted, I think the Lancet, which was published by I think one of the US papers. That shows that indeed, there are many of young people who have not smoked cigarette before. They have not tasted traditional cigarette before or tobacco before, but are using e-cigarette. So that is why I always call the industry as as liars. As very deceptive people. Yeah. You look at their interests. They care less about what happens to anybody. Otherwise, why would you continue to produce a product that kills? It has no benefit whatsoever. Exactly. Why it has to destroy you. Yeah.
And that's why it's the product that kills the most people, as when used as prescribed.
As prescribed by the manufacturer. So the point for me is, and the so-called harm reduction strategy, that they are bringing up, the fact that is going to help people. I kept on saying, Africa has the lowest prevalence of smoking. And we have used the FCTC as a mechanism to reduce the prevalence. Yes, and maintain it. In fact, Ghana were, I mean, our prevalence was about 5, but now we are about 3 point something. I mean, less than 4% of prevalence. And we have, practically used the FCTC as a mechanical tool, and it's helping us to advance. So the point is that Africa don't need anything like harm reduction strategy.
Thank you.
We would continue to implement effectively, and then we would collaborate with government to advance policies. But the policies are already there. I mean, to ensure that the policies are working. It's about ensuring that we invest into the already developed, mechanism, whether the Empower or the technical package Empower or the WHO FCTC, and we'll get there. We don't need any foreign, harm reduction strategies. I mean, because that will rather impact more on us. Already we are seeing the impact that is having on us negatively.
In Kenya, I'm really seeing that they're really targeting young people, the harm reduction narrative. They're in universities, they're funding research work, which is, it's very bad because they're pushing a very false narrative. And there's something we have to do about it. We just have to do something about it.
Definitely. And I'm sure it's part of the thing that we are doing right now. Yes. And we'll continue to advocate, for our policymakers to know that indeed these are no benefits. We just have to ban it. Ghana have banned. We still have, our porous budget, which is, sometimes very weak. So we still have this problem in the system. Fortunately for us, once we report them, the authorities are ready to move with us and then confiscate them. And we bend them.
And so for others, we are really happy about
it. The graphic acronyms. You're moving towards plain packaging.
Yeah.
And that's commendable.
Yeah. So this is something we are working on. I know some other countries have gone plain packaging. I think our next phase in terms of our, front of pack, would be to go plain package. It's on the radar, and I'm sure that with time we would get there. We want to create an environment where everybody see tobacco as, as an evil product, as a product that has no benefit, so that people will just shun it, and eventually we would say, bye-bye to, and many countries are going to do this the end game. The end game, it is not anything magic. A country might just set their own priorities. So maybe by the next 10 years, we want to phase out all those generations born today will never touch tobacco. This has been done by is it UK or so? So these are mechanisms that we can do, but we must also strengthen our healthcare system to be able to track children who are coming there. How do you ensure that they are prevented from even seeing? The issue is about the appeal, the access, because if they get to see it, they get to people they see their idols, and that's where the challenge is sometimes. Celebrities, who they follow, and we also need to call them to order, our celebrities, that they need to be prioritizing or putting or investing into things that will inure into the benefit of millions of followers that are following them. I don't think any celebrity would want to see, even one of his or her die-hard, a follower and being diagnosed with cancer or any chronic condition as a result of smoking. And that smoking would have come as a result of your smoking, on the screen. It might turn out that you don't smoke, but the fact that you are portraying it, on your screen, on the screen, whether in movies or your music and videos, automatically, they would do, and people would overdo it, and eventually will lead them to destruction.
Yeah. And you've seen the real effects, and it's so sad that these things are happening. Yeah, and you've experienced it personally in your life. So anyway, thank you so much for sharing your experience. I am really grateful. We'll definitely talk more and catch up and inspire the next generation of champions. People with a lot of vigor, a lot of energy will come and also compliment the champions. Definitely compliment this one doing the one. So lastly, your vision for Africa.
Well, so my vision for Africa, someone will say, will you even live to see it? I'm very hopeful that we will live to see, the destruction of, the tobacco industry. I mean, so ensuring that at least in the next 5 to 10 years, tobacco become, this incentive. People will not prioritize it in our part of the world. But like I said, it also boiled down with, policymakers. And I know that we are now having, a crop of policymakers who are coming up, and they will definitely see that there's a need for us to, to have the willpower and then say no to industry interferences in public health policy.
Exactly. Thank you so much. Thank you so much for watching the tobacco control story of Ghana featuring Labram. Please like and subscribe.